Hello everyone, this is Dr. Garima Sachdeva and continuing with our series on contraception, today we'll be discussing about how does enzyme inducer affect emergency contraceptive. So what we'll be discussing is first what all drugs are enzyme inducer, secondly what effect do they have on emergency contraception. Now moving on to discussing what these enzyme inducer drugs are. So you can remember it with a simple mnemonic: 3 pins, 3 P's and 1 toppy. So these are basically anti-epileptic drugs which are carbamazepine. Pins are carbamazepine, eslicarbamazepine, oxcarbamazepine. 3 P's are phenobarbital, phenytoin, primidone. Then 1 toppy is topiramate. The other ones are rifunamide. Then antibacterials include rifabutin and rifampicin. Then antiretrovirals which include efavirenz and nevirapine. Then antidepressants like St. John's wort, and the other drugs are there which are like modafinil, bisanton and other uncommon drugs. So these are the important enzyme inducers, and now we will study how it affects the various emergency contraceptive choices. So as we have discussed, there are 3 contraceptive options that we have for emergency contraception. The first one is copper IUCD, the second one is LNG, and the third is ulipristal. So when you are planning for emergency contraceptive, copper, it doesn't affect copper IUCD. It can be used. Ulipristal acetate generally should be avoided, and in case LNG has to be used, you have to give double dose, that is 3 milligram. Okay, just to repeat, so if a patient is taking enzyme inducer, which I've already mentioned, and is had unprotected sexual intercourse while on enzyme inducer or within 28 days of stopping it. This 28 days is also important because you can get scenarios based on that. They can give you that she has stopped enzyme inducer 14 days back. Now what will you do? So again, your answer will be the same. Copper IUCD, yes, can be given. Ulipristal, ideally avoided. In case you have to give LNG, the best is you give double dose, that is instead of 1.5 milligram, you give 3 milligram. Hope this is clear. So just to repeat, copper IUCD, it is not affected by the enzyme inducer and is the first line. Second option is LNG, double dose, that is 3 milligram. And the third and least effective option, which is generally avoided, is ulipristal acetate. So this was about the emergency contraception and how it is affected by the enzyme inducers. Hope it was useful. Thank you so much for watching.